All right, so let's stay with the subject, get the latest trends on where we are with COVID-19. I'm joined by Dr. Nicholas Crisp, who is the Health Department Deputy Director General. Dr. Crisp, thanks for your time. So we're hearing this phrase, population immunity or herd immunity, popping up. For a while it seemed it was something we weren't going for, that it was everyone for themselves, get your vaccination and just worry about yourself. Has there been a slight tweak on the strategy of late?
Good evening, Sally, and good evening to the viewers. I think that with any pandemic, one learns quite a lot as you go along. We're not really talking about herd immunity as such. What we do know is that if you get as large a number of possible people immune at the same time, you get on top of the variants and the mutations of a virus. So I guess that is what herd immunity is about. But exactly where that cutoff is elusive, and it takes a very long time to get there. We do need to get a large number of people immune, and we need them to have sustained immunity, which is why we need vaccination, and can't just rely on lots of us getting sick and hoping that we have some degree of immunity from that.
So when you break down where we are on the vaccinations, I think it's around 41% fully vaccinated for adults, but we know that we're most concerned about people over 60. Are they still the most vulnerable, and how is the vaccination rate there?
Yeah, so thanks very much. Yeah, we do know that people, the older you are, the more vulnerable you are for a number of reasons. One, your immunity wanes. You're likely to have more concomitant disease, or what people call comorbidities, and some of those additional diseases you may have are chronic diseases that suppress your immunity and make you more vulnerable. So that is likely to happen. But age alone, even without any other illness, appears to still be a problem. Fortunately, in some parts of the country, we have in excess of 70% of that population vaccinated. And that, since they are now protected, they don't get as severe infections if they are exposed, and they won't end up in hospital and dying. But everybody does get exposed, and even people that are young do get sick, and some can get very sick. Not only people who have some form of compromised immune system. So we want to make sure that everybody has immunity and is vaccinated. And right now, the population between the ages of 18 and 39 are the most vulnerable because they are the least vaccinated. They are protected by their age, but not entirely. So we do have 42% of the population, the adult population, totally fully vaccinated. We have 48% that have had at least one dose, and close to 60% that have had some kind of exposure or dose. That, according to what we are seeing. Yeah. So we've done almost 31 million vaccinations at the moment. We need to be doing a lot more than we're doing right now if we're going to protect ourselves before we go into winter.
Just a point of clarity, are we talking about an 18 to 34 age group or 18 to 39? You just mentioned 18 to 39.
Yeah, so it's 18 to 49 are two different cohorts that are all vulnerable, but it's the 18 to 39s that are, because we break it down in 5-year age groups when we look at it. So we can see that within those bands, people are least vaccinated, and then it starts to increase. To be fair, older people have had a much longer time. In fact, it's exactly a year since yesterday when the first vaccinations were given as part of the eNCA study. So we've had a year to vaccinate healthcare workers, and then since May last year to vaccinate those of us who are over 60, and young people have not had as much time to get vaccinated. But we are heading towards the winter months when we are more vulnerable. So now we really need to step up and make sure more people get vaccine.
Why are younger people not getting vaccinated? Is it because they are younger and they feel more safe? Is it because, particularly, closer to the teenage years, I would imagine there's a natural sort of pushing against authority and a distrust of what authority tells you? Or are they, as consumers often of a lot of social media, have they ingested the message, the fake news around vaccines, the safety concerns and the side effects being unreported, which of course is not true?
Yeah, so Sally, I think it's all of those things. It's true that young people are less exposed, or they're as exposed, but they are less vulnerable to severe illness. So there's a feeling, well, I'm not so going to be so affected, so maybe I need vaccine less. And especially if I've seen something on some social media that suggests there might be something wrong, and I'm pushing back against authority. And quite frankly, we as the establishment don't really do a lot to make young people proud of us as a society, and we need to shape up as well. So I think we're all in this together, but young people have a lot to live for. They are the future of the country. They need to have to use their opportunities. You can't travel, you can't study, you can't do all kinds of things if you can't show that you're vaccinated. And that's why we talk about Kiredi. I am ready. I have taken the necessary precautions, and I'm ready to take opportunities for work or for study or for travel or for partying or for whatever it is, because I know I'm vaccinated. So I think that's the message to young people. We don't want to tell you what to do. We want you to go and find out for yourself, talk to your peers, understand the facts, ask the hard questions. We'll do our best to answer them. But the future's in your hands. We've had our shot already.
Yeah, in more ways than one. It's very interesting that it's a focus on engagement, which I think is absolutely important. I just want to move to another issue. Yesterday, I spoke to the Ministerial Advisory Committee's Prof. eNCA about the request from the tourism industry, from the Tourism Business Council, asking for that PCR test for inbound tourists to be immediately dropped. The Ministerial Advisory Committee has advised that it happens. I know that ultimately this does sort of end up with the Health Department and the politicians making that call. But could you tell me if the Health Department has a view? Do you agree with the Ministerial Advisory Committee that efforts should be elsewhere at this point and we should drop that PCR test?
Yeah, so Sally, I think there are a number of the measures, including that one, which have been under review, and we specifically asked the Ministerial Advisory Committee to look at that recommendation. But health is not the only affected department. There are other departments, including Home Affairs, who manages the border control, including tourism themselves, and there are others. So we need to respect our colleagues in other departments, take this advice that we've got from the Ministerial Committee and engage with them before we make pronouncements. But I think that as health professionals, we are less convinced that that is useful at this point. The pandemic, and now that we are winding down to sort of epidemics within an endemic type of environment, is easier to manage, and we are at this stage not under huge pressure. And the more we can relieve those stresses and the costs associated with them and the impediments to movement, the better. We will take that into the discussion with our colleagues in other departments and put our case, but they will have other reasons for doing things as well, and we need to hear one another.
All right. Well, let's hope that there's a sense of urgency around this, because this could make a big difference, and it's a quick one to stop. So we'll wait to hear from you on when things move forward on that. I have to ask you a final question. We know the fourth wave is over. We are seeing the numbers ticking up a little. Is it anything to worry about? Is it giving us an idea of what the fifth wave might look like and when it might begin?
Yeah, Sally, so each wave has been a different shape, and quite interesting how that has happened. In retrospect, it's quite easy to understand why they behave differently. So then in the fourth wave, for instance, we saw a very, very wide base, but not quite as high, and it was not nearly as steep. So in other words, the transmission was not as effective as we have seen now with Omicron, but it was more aggressive, and we saw more ill people over a longer period of time. And as people moved, you saw different provinces with different periods of time being affected. Now with Omicron, it happened very fast. The transmission was very high, very fast, but it's taken a long time to come down. Part of that is because of the way in which it's moving in small parts of the community, and we can watch in districts and sub-districts how it is dragging on for some time. So I think it's going to grumble on for some time still. It's not worrisome. It is not a new variant. We are seeing two sub-variants, one of which seems to be taking over, but it's not showing signs that it's more aggressive or behaving in a different way from the Omicron. Fortunately, our science and our laboratories are incredibly well organized, and really efficient. So we get information every day, and it's very, very reliable information. So we are not worried about anything at the moment. Obviously, we'd like to see the numbers drop. We don't like seeing so many sick people. And we hope that we get some real respite before whatever's going to come at us just before winter.
All right, I have to ask you, what is the latest thinking on when the 5th wave could hit us?
We don't really know, but based on what we've seen in the patterns before, we expect that it will mimic what we've seen in last year, and it will pick up sometime in May. We don't know whether it'll be just a mild, different variant or slightly different variant of what we've got now with minor mutations, or whether we'll get something dramatically different once more. The way that these things normally work is we would not expect to see, something like we saw with Omicron, which was massive numbers of mutations. But from where I sit, we've learned to be very cautious about what we say about coronavirus. It behaves in very strange ways, and we will be ready for whatever is thrown at us, probably towards the end of May and into June and July.
Yeah, you're becoming veritable COVID ninjas at this point, 2 years in. Thank you so much for chatting to us this Friday night. That's the Department of Health Deputy Director General, Dr. Nicholas Crisp.